Good afternoon, everyone. I'm Haley McCullough, an ORISE Fellow appointed to CDC's Center for Preparedness and Response, Division of Emergency Operations. Thank you for joining us for today's EPIC webinar titled 2019 Resolution, Create Your Crisis Communication Plan. Today, we will hear from CDC's Kellee Waters. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC1219 with all letters capitalized. To repeat, the course access code to receive continuing education units is, in all caps, EPIC1219. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenter has presented. Closed captions are also available for this webinar. Detail on how to view the closed captions on the screen and in the chat box. We are very fortunate today to have our colleague Kellee Waters as our speaker. Kellee supports the Emergency Risk Communication Branch, which oversees the SURG program. Kellee has over 15 years experience in public health communication. She has provided communication support during emergency responses to H1N1, Ebola, Zika, and the 2017 hurricane season, and others. Previously, she served as an editor, media liaison, and public information officer to both internal and external partners, including congressional correspondents. She currently leads the SURG program and has conducted numerous national and international trainings on the subject matter. Thank you so much for joining us today, Kellee. Please begin.
Thank you, Haley. And good afternoon, everyone. Thank you for joining. As Haley said, today we're going to talk about crisis communication planning, which is part of our crisis and emergency risk communication curriculum. And as part of this, we're going to talk about it in terms of New Year's resolutions, making crisis communication planning something that you aim to do in the New Year's, to be prepared for anything that may come at you. In 2019, what do we all want to do? We all promise that we're gonna eat healthier, we're gonna exercise more. We all have these resolutions to do things personally. We all have these things to do things professionally, to be better people, to be better employees. And what we want to encourage you today to do is be better prepared to communicate in emergencies. Before we do that, we wanted to look a little bit at crisis and emergency risk communication so that you have a foundation for what SURG is, for what the context of a crisis communication plan might include. If you've already taken SURG training, then some of this will be repetitive, and I appreciate your patience. If you have not taken SURG training, then at the end of this webinar, we'll connect you with some resources where you can get more information. We do offer in-person trainings. We offer our online training as well on our website, so you can get more information if this basic overview doesn't give you enough detail. But really quickly, I want to give you some of the highlights of what SURG entails. To begin with, SURG principles, in a nutshell, help you provide information to people to help them make the best out of a bad situation. So a crisis, by definition, is not going to give you the best options. You're not going to have the best choices to make. You're going to have extremely challenging time constraints, and people have to make the best decisions they can within those confines. Now, the perk of SURG, I don't mean to rhyme there, is that we have the expertise. We know some of the best ways that people can make those decisions to protect themselves, to keep themselves safe, to get themselves out of harm's way, to minimize the damage to themselves and their health. So SURG gives you some guidance on how to communicate that guidance well. The right message at the right time from the right person can save lives. That's what we're aiming for. If we can get people the right message, what we say at the right time when we say it, that's crucial. From the right person who says it, and that may not be, in our case, it may not be CDC. It may be another federal agency. For those of you listening, it may not be your organization. It might be a local community member to help share your message, someone who has more credibility. But the combination of these three things really can help save lives. It can help people hear a message, understand a message, and accept a message so that they will act on that message. SURG has been around since 2002. It's been revised based on the additional experience and the lessons learned from recent public health emergencies, including Ebola, Zika, some things you may have heard of in the headlines. And what we've done since the initial concept was drafted is hopefully make shorter, more easily accessible resources. We've tried to build a framework that you can access with more convenience during an emergency. SURG boils down to these 6 principles. The first principle, be first, doesn't mean that you have to be first to say anything. It means be first with the information that is in your lane. So if we're the CDC, it's our responsibility to be first with public health information, with guidance that can help improve people's mortality and morbidity, the outcomes of their well-being in an emergency. It doesn't mean that we compete with the iReporters and everyone with a camera phone. So don't feel the pressure to be first to say anything, but if it is in your lane, if you are the expert in that field and in your area, it is your responsibility to be first when people are looking to you for information. That leads us to being right. You want to be right, but you don't want to wait to say something. So to be first and be right, say what you do know. You can say what the circumstances are. Okay, you can explain what you're already aware of, but then you can also say what you don't know. You can explain what information you still need to gather, and then you can explain the process to people. That's how you're right. Include people in the process because it's not your response, it's their response. They're being affected by this crisis. So part of being right doesn't mean that you know all the answers. It's telling people what you know, what you don't know, and what you're doing to get the answers. And that leads to being credible. We want to tell the truth. And that should seem intuitive, but we say things like, it's going to be okay. We don't know that it's going to be okay. That's a pretty vague statement. And we may say things based on speculation that we can't back up by data. So it's not that we're lying intentionally, but we want to be very, very careful to be credible in a crisis. We want to say things that we know we can confirm. We also want to express empathy. And the reason this is included in here is because while we are a professional organization, the circumstances of a crisis are different than everyday circumstances. You're dealing with people who are emotionally compromised to be accepting messages. They have experienced loss, they have experienced disaster, they have experienced destruction, and they need to understand that you understand what they're going through before they can listen to your message. So expressing empathy is putting into words what people are feeling. It's saying, we understand this is a scary situation. We understand these are uncertain circumstances. Putting into words, identifying what people are feeling shows that you're paying attention to what they're feeling and that you're really listening and you're really in the moment with them. Which leads us to promoting action. And this right here is what SURG comes down to. The whole point of communicating in a crisis is to encourage people to act in their well-being. So we want to give people meaningful things to do that will protect their lives, that will keep them healthy, that will keep them safe, that will help a community work towards rebuilding. Promoting action is a win for us, but it's also a win for people who have been affected in an emergency because it can help to distract, not remove fear, not remove anxiety, but it can help a bit to distract from the upset that they've gone through. So rather than just sitting and waiting for other people to do for them and worrying about what they've lost and lingering on how bad the situation is, they can participate in their own recovery. So promoting action is extremely important and really what SURG is all about. The sixth principle I really wish wasn't a principle. It should be intuitive, but it's understandably something that we like to put out there as a reminder. Show respect. It's important for everyone in a crisis to show respect because people get distracted by their own tasks. Responders are so focused on what they need to do. Responders are so focused on their next assignment, their next task, their next community, their next what they're there to help with. And while the intentions may be good, there needs to be a respectful manner in which all of this work is done as well. Now, people who are affected by a crisis also may not be showing respect to each other. They may be focused, understandably, just on themselves, just on their losses, just on their family, just on their, just on their immediate circle. And it's good to encourage people to help their neighbors, to check on their neighbors, to work as a community. This really does encourage community efficacy and helps rebuilding. So all of these 6 principles combined, you don't have to memorize them, but keep them in mind, will really help a crisis communication plan come together and will help crisis communication flow throughout a response. A SURG rhythm, when I say throughout a response, a SURG rhythm is something that applies to every crisis, no matter how long, whether it's 2 days, 2 weeks, 2 months, or in some cases, 2 years. Preparation is what you're doing right now. It's you taking a class. It's learning about how to do things well. It's what we're going to talk about, developing a crisis communication plan or revisiting one that you already have to make it better. You can draft messages and test them. You can develop new partnerships or update the partners that you have. So preparation is what we're doing today and what we're discussing today. The initial phase of a rhythm is when a crisis happens. It's right when the crisis happens. So you'll see in there, express empathy, promote action. That's where the SURG principles come into play. But if you haven't done anything to prepare, you're gonna find yourself struggling a little to get started with your response. The maintenance phase is something that happens, again, with every crisis, no matter how long, but the length of the maintenance phase can become a bit interesting. So if it's a shorter response, your maintenance phase is going to give you some opportunity to find out more information about the crisis, get a little more background on what happened, and be able to provide that information. In a longer response, the longer the maintenance phase is, the more questions are going to arise. So people will ask things like, whose fault is this? Could it have been prevented? Your response is going to get critiqued. More rumors may surface, and you'll have to address those. The resolution phase is what it sounds like. The community is settling into a new normal. They are becoming resolved to the new situation post-crisis. This is a really good time for your communications to focus on lessons learned while things are still fresh in people's minds, and to incorporate those lessons into your crisis communication plan if it helps you to revise that and make it better. What you see throughout is engaging community. Your community needs to be part of the response always. Responders are experts in the field of emergency response, but we need our community members to tell us how they receive messages, how they hear messages best, what we need to be doing to speak to them, what their needs are. Because we need them to take action, and to do that, we need to empower them to make those decisions. Evaluation used to be the 5th phase of the SURG rhythm, and now it's at the top because it's something that you should be doing all the time. Evaluation is necessary so that you can change. If something's not working, you need to reevaluate, readdress, and make it better. So with the basis of SURG in mind, and again, that was an extremely brief overview of SURG, we're going to talk about how to incorporate some of that into a crisis communication plan. So a crisis communication plan in the preparation phase is important because you need to understand what your organization would do when a crisis happened. If you have a crisis communication plan, if you know you have one, do you know what it says? Has anyone read it? Does it have 3 inches of dust on it? Are all of the communication contacts listed in it retired? The point of a crisis communication plan is not to do this once and put it on a shelf and say that it's something you've done. The point is to be something that is active, a living document that you can just grab when an incident happens, reference quickly for your basic needs in a communication response, and be able to use. It's not meant to be complicated, and it's not meant to give you more paperwork. It's meant to be helpful. It's meant to be a really useful tool to anyone working on an emergency in your organization. So you plan for the crisis to understand what the best practices are for engaging with your stakeholders. You do that by understanding who your stakeholders are. You want to be able to list those people. You want to understand who you're talking to in your community. By understanding what types of messages those audiences need. Understanding what languages they need to come in, what types of messages they are going to hear, whether they need to be written out, whether they need to be visual, and making sure that this is something that is readily available, whether it's having copies, hard copies that you can just pass out, whether it's having a website that is easily accessible, making sure that your plan is something that anyone working on your response can get to quickly. So your plan should be realistic. Realistic means if you live in Florida, for example, you probably want to have a crisis communication plan for hurricanes because it's something you're likely to have to deal with. If you live in the Midwest, perhaps you have a crisis communication plan for tornadoes, but maybe not the opposite. So if we live in an area that's not affected by severe weather, we don't necessarily have to deal with developing a crisis communication plan for those particular events. Your plan should be realistic for your area. Those things you're probably going to have to deal with, things that you've dealt with on a regular basis. However, it should also account for worst case scenarios. So while we may not want to account for alien invasion, maybe accounting for that worst case 12-foot snowstorm where power's out for an entire week and there's no salt to cover the roads. So we're thinking about worst case scenarios in areas of realistic situations. I hope that makes sense. And then knowing what to include, knowing your area. You're experts on where you respond. So you know your communities, you know who lives there, you know what languages they speak, you know the socioeconomic levels, you know your resources, you know who your partners should be. And those are the things that should go in a plan. We're going to talk a little bit more about that in a second. The plan should be a resource for necessary information. It doesn't need to be complicated. Again, this is as developed and detailed as you want it to be. You can have a plan that is for all hazards. So it covers the gamut from natural disasters to infectious diseases, and it can list all of your contacts in all of those situations. Or you can have specific plans for specific incidents. Like I said, if you know you live in an area that's affected by particular natural disasters, you could have an all hazards plan and one that's specific to a hurricane, a tornado, an earthquake. So this is just meant to be useful for your organization. Again, this is something that's helpful. It's a tool. It's not meant to make your life more difficult. It should be kept current though. If you write this plan and don't readdress it, you're going to have outdated points of contact. You're going to have outdated messaging. So it's something that if you are going to use it, if you are going to do it, it really needs to be updated on a regular basis. So what to consider when you're writing your plan? These are the things that I said you should think about including. What you want to include is a scenario. So this is what we mentioned when I said you can consider an all hazards plan, or you can consider doing a specific crisis. That would be your scenario. If we were to have a hurricane and it were a Category 5 and we were to have record flooding, so that could be your scenario, then we would do the following. That could be your scenario. You can make that as broad, affecting the whole state, affecting your region. Again, it's what is useful to your organization. And then with your community goals, with your communication goals, you really should list those out. Your communication goals are to prevent illness and injury, but specifically for that hazard, what are your communication goals? And they should be listed out. Your key assumptions. These are things that you want to identify and consider as you're developing a plan, and they should also be changed as the plan evolves. So for example, your key assumptions are certain things about maybe you have an infectious disease outbreak and people are showing symptoms that are flu-like, for example. So a key assumption would be that maybe people wash their hands and cover their cough, but the scientific knowledge will change. Your knowledge of the situation will evolve, so your key assumptions will change too. Key assumptions are also your resources, your considerations. So your resources, your partners in this case, those things are also key assumptions, things that you want to list there. Your messages. This is where you can have pre-cleared, pre-tested messages available that can be tailored specific to any crisis. So if you have a pretty aggressive or just a standard or regular flu season every year, then it's reasonable to include flu type messaging in your crisis communication plan that you can pull from and just tailor when a flu type crisis arises. You can make it specific, and you should make it specific to that event, but you already have some language to go on. So you're not working from scratch on absolutely everything. Your spokesperson should be listed, and you'll see there it says spokespersons, because you're going to have people who aren't available, who themselves are affected by the crisis, who maybe can't make it in because of the crisis. Their house is underwater, their car is under a tree. So you're going to want to identify a spokesperson. You're going to want to identify a backup to the backup to the backup. That's what the crisis communication plan does. It considers all of these contingencies so that you're ready in a crisis. So what you want to consider with your crisis communication plan is the audiences that your organization might have to speak to. And some of this is, like I said, you're going to want to consider the languages that people speak. How many languages will you have to have your messages translated into? You're going to want to consider the demographics of your communities. So race, religion, education, socioeconomic level, all of these are really important. And these considerations inform how you develop your messages, how you communicate. They're going to determine whether your messages need to be more visual versus more content, written out, heavy. They're going to determine how you reach people in your area. Is it more valuable for people to get messages from an authority figure, from a public health department, or from their local pastor? Is it more valuable for them to hear from a spokesperson that they know and trust? All of this is to help people accept these messages so that they will be willing and able to take action. And then when you are able to identify those audiences, you need to consider how you're going to get those messages out. And again, for the same reason, you want to make sure that you're getting the messages out through the right channels to make sure that everyone who's been affected by a crisis is hearing the messages that they need to hear to keep themselves safe and healthy. So as with audiences, how would you disseminate messages depends on your community. Do people prefer to get messages through traditional channels or through social media channels, more updated, more current channels. There have been responses in the past where we have been really lucky in using social media at CDC to disseminate messages very, very quickly to large mass audiences. But then there are also communities. For example, we worked in Flint, Michigan, where a lot of the community was extremely personally active in sharing messages through church meetings, so face-to-face meetings, and flyers and handouts and town hall discussions. So it just depends on how people like to receive their meetings, and this is something that you should know ahead of time. That's why in the crisis communication plan you should be aware of your community and their preferences. The messages, when you do consider these channels, you also have to consider your staff, how you're going to do this. So for example, if you do a hotline, you want to make sure that you have the resources to staff a hotline. So if you offer something here, you don't have to offer anything. You don't have to offer all of these things. You can pick and choose what works for your community, but you do need to make sure that you're able to manage the choices that you offer. If you offer a hotline, you're going to need to make sure they get updated messages. You're going to need to make sure that you have staff to run that hotline. Is it a 24/7 hotline? So those things need to be considerations, and they need to be part of your communication plan. Same goes for social media. You probably shouldn't have all of the handles monitored all at once. A crisis is very time consuming. So choose the ones that you can manage. As with everything discussed, like I said, you may have the capacity to choose all of these, which is wonderful. You may have the capacity to only choose a few, and that's fine. Your partners can be extremely helpful in this capacity. So your partners as communication channels, getting them to help you share messages will help things go much further. And they can serve as a spokesperson as well. They can be a trusted resource for spreading your message. The SURG chapter on developing crisis communication plans is posted on our website, and it offers a lot more detail. It gives you a lot more reference points for what you can consider including in a crisis communication plan. There are also tools and templates out there to help you further. There are some examples of crisis communication plans floating around the web, and CDC actually has some posted on the internet too that you can look at. There are local health departments, including the California Department of Public Health Crisis and Emergency Risk Communication Toolkit. It's a great resource to look at to see what they did at a local level to develop a crisis communication plan. So there are a lot of resources out there. It would take way longer than this webinar for me to list them all for you. But what I would like to show you is some resources that are available. Our SURG website, like I said, has resources and tools that can help you develop a crisis communication plan, a template, and our manual. So they're no longer listed by number. It's our 5th chapter, but the crisis communication plan chapter includes information on how to develop a crisis communication plan in more detail. If you have questions after this webinar, I'm happy to answer questions in a moment, but if you come up with a question that you didn't have time to ask or forgot to ask, you can also always email us, and we can try to help you that way. So these are some resources to help you. Again, this is just to make sure that when 2019 comes, your organization is prepared and ready for anything that may come. So Haley, I am ready to take questions if you would like to ask them.
All right, I will give people a moment to go ahead and enter their questions in the Q&A section. As of right now, we don't have any questions.
Okay. Well, what I can do then is try to show you a sample of what a crisis communication plan looks like, if that's something that would be helpful. And we will wait for questions to come in. If anybody, again, has any, happy to answer them now. And if not, please do send them to that email address that is in the slide deck. The slides will be posted on the website with the webinar, and they will also be available in this invitation in the announcement, I think. Okay, so let me do this very quickly. Okay, so I'm going to share very quickly, sorry for a bit of a mess here, what a crisis communication plan might look like. This is a very, very rough template, so please forgive the roughness of it, but it's something that we use to do exercises when I teach a live SURG course. And you'll see there, the scenario would detail the hazard that might affect your area. So again, something that might be local to you, could be all hazard, could be specific, okay? It could be a natural disaster, it could be infectious disease, it could be a bad flu, it could be anything. Communication goals, again, those are what you're after. Those are the actions that you want to promote. So your communication should always really be promoting action, and you can list those there. The key assumptions, again, right there is where you want to list things that you already know and things that you have. So the resources and things that are available to you. When you look at the messages, knowing that you're going to have to update them and knowing that you're going to have to tailor them, you can still guess for every hazard the things that people might be asking, or based on previous hazards that you've worked on, the things that people have asked before. So who is in charge? What are they doing to investigate? What are the health authorities doing to address the situation? How concerned should the public be about the situation? What are the risks to the community? Other things, what should our family do? Are we safe? Whose fault is this? Some of these answers you may not have, but some of them you might. And you can anticipate some of these questions based on, like I said, previous emergencies that you've worked on, and things that you yourself as a community member would want to know. Audiences are the people that live in your area, the people that travel to your area, the people that work in your area. So these are the people that you're going to want to talk to. And as you can see, we've listed several examples here. You're going to be able to talk to, we've broken them down by categories, but several of these are going to overlap. That's good news, because if you talk to people who live in, work in the travel industry, but they also live in the area, or community organizations, people who are in schools and faith-based organizations who also work in the medical field, you're hoping that every message that gets to these different audiences is the same message. So they're hearing it the same place, they're hearing the same message at all of these different outlets from all of these different places. So clinicians, healthcare providers are getting the same information as public health officials. They're getting the same information as the travel industry, and they're getting the same information as all of your partners. Again, this is not an inclusive list. You can definitely expand on this. This is a template. It's just an example. And some examples of primary communication channels. So traditional channels, media, news, papers, news, television news, or social media, websites, radio PSAs, etc. I think we've got
Kellee?
some questions. Yeah.
We do have some questions. Some of these are questions a little bit outside of the scope of the presentation. So if we don't get to your question here, we would ask that you send it to epic@cdc.gov, and we can follow up that way to connect with the experts within CDC who can answer the question. This comes from Julia. What's your advice about communicating to a church congregation? Many different types of people, education levels, etc.
We've done this in several different emergencies in the past couple of years, which is actually why we changed our SURG manual to include an entire chapter on community engagement. So what we ended up realizing was that our highly scientific and our highly technical strategies for communication using social media and traditional media channels wasn't covering the gamut of people who needed information in a lot of our emergencies. So we started going out into the community, doing outreach, doing in-person, face-to-face public health awareness campaigns, and realizing that some of our materials were way too content heavy. So making images more visual, less words, more pictures, speaking with those spokespersons, getting buy-in from the community, so getting pastors to help us share our messages, helping them understand the messages so that they would be willing to share them. It's challenging if there's not an understanding. So like I said, in Flint, Michigan, orthophosphates is the term for what was preventing the pipes in the Flint water system from protecting people from being exposed to lead. That's an extremely scientific word. It was on a lot of flyers. It was very confusing. So sitting down and explaining some of the science, making that more clear, but also just having a conversation, showing up. So we actually came to some of the Sunday services. We actually showed up and said, hey, we'll answer some questions if you're not understanding. So getting community spokespersons to share the messages, but when there's questions, also offering to show up and be an SME and say, if you have questions, we're here. Hosting a town hall, hosting a meeting in the community where you make yourself available to clarify those issues. So we've done all of these things in several different types of responses that I've participated in the last few years, specifically because that gap was there and we were seeing it impacting people's actions.
Thank you, Kellee. Another one. What were some of the lessons from the 2017 hurricane season?
The 2017 hurricane season actually might be better answered by Jonathan, because he was more of a participant in it than I was. I was involved in some of the communications. I was doing more SURG trainings out of state while the response was going on. So I'll actually punt that to Jonathan.
I'll take that back.
Yeah.
So a very large number of lessons. So that could be, 2 whole webinars to answer that. But I would say the biggest lesson is the need to plan ahead for a communication breakdown. When all the electronic methods of communication are down, and you're going to wind up printing millions of documents and distributing them to people physically just to help inform them on how to stay safe. For me, at least, from my limited perspective on that, it's the need to plan ahead to have that capability. Okay, we'll go on to the next question. Kellee, can you discuss again the key assumptions and considerations for a SURG plan?
Sure. So key assumptions are things that you already know about your organization, things that you already know about where you live, things that you already know about your partner organizations, things that you already know about your resources. So, for example, you know that you have, as an example, what Jonathan was just saying, you know that you have access to a dozen walkie-talkies if all the power goes out. You know that you have gas-operated vehicles and access to a route to pick up staff, as long as everyone's okay, to get everyone to the emergency operations center via this route within 24 hours. Things, I'm making, of course, this up as I go along right now, but it's things like that. It's things that you have access to, people you have access to, and the things that you already know about a situation that will be useful in that situation. Where you get into points of contact, et cetera, there's a list. We didn't get all the way down there, but you can list those out further down more specifically. But key assumptions are things that you're already aware of about a situation like this.
Okay, the next question. Do you have specific resources for planning in nursing home situations, or just in general, how can one find resources for making communication plans for different types of scenarios?
So I wish I had a better answer for you than this. There are so many out there. Google. We, like I said, we have templates, but our templates are not specific to, like, the template I showed you is our template. It's not filled out because it's meant to be an exercise. It's meant to be something that we do with different organizations, and it's meant to be different for every organization. So every organization has to tailor their communication plan to fit their needs. So as far as we go, it's not something that we have on hand, but I did read out to you, for example, the California Department of Public Health developed their own crisis and emergency risk communication toolkit. It's extremely helpful. It's something you might want to look at. There are other resources out there. They are online, and you would really just have to kind of do a little bit of a web search for them. I wish I had a better answer than that.
I'm going to go on to, I'll actually field this question from Emma Hossman. She asked, how do you integrate communications for people with access and functional needs? And Emma, this is actually a large part of our planning ahead of time. This particular webinar, for example, we arranged for closed captioning with a provider who can offer that service. It takes pre-planning, and you can find some guidance by looking up Section 508 compliance requirements, so that, for example, you can make sure that you do have some form of closed captioning for video. You can make sure that you have, on web pages, you have alt text and things like that. These capabilities will add to the ability for people with limited access, or maybe limited ability to perceive one modality of communication. This will enable them to perceive the communication from another modality. I would say that if you're doing it at the moment of an emergency, it's too late. So have documents made ahead of time, and then have variations of those documents. So for example, it may be something that's printable, or it may be a PSA that you've already recorded. If you have some basic information, some basic products already ready, then when you need to share them through different channels that work for people with limited access, you'll be able to do so. And you can find a lot of those kind of documents actually on the CDC website.
To expand on that also, in two ways. What our group does, what the Emergency Partner Information Connection does outside of emergencies, is build partnerships with organizations that can help us reach out to to populations that may not get information through all the traditional channels. So that's a really important point that I want to express, or that I want to emphasize for your crisis communication plan, is really identifying those partners in your community who can help you reach out to those populations. For example, Meals on Wheels, YMCAs, and all these any kind of hearing, visual impairment societies, things that are established specifically to reach out to communities with tailored needs for communications, and plan those partnerships, build those partnerships now, plan them into your crisis communication plan. And that would be part of, remember I talked about the rhythm, that would be part of your pre-crisis planning. But then also doing educational events in the pre-crisis phase, so that you can go to these communities and express what your resources are, who you are, what you have available, so people can get themselves prepared.
Let's go to Skip Rowe's question. What is the best way to determine the scope of a communication plan? or he puts it, or how far outside of your agency should it reach?
The communication plan should be what your agency is going to do. So you should know what your roles are going to be within your specific group. Now, that said, you should be aware where you fall inside inside of an emergency that gets bigger. So if it's something that happens, say, again, all hypothetical, if it's something that happens at the county level, know where your organization falls in the county level. If it becomes bigger, if it becomes citywide, know your role as, know how you will contribute at that level. So it should outline what your role would be and who you would report to, but it doesn't have to include the roles of everyone else. It doesn't have to be that specific unless you want it to be, unless that's helpful to you. So you don't have to write out the structure of a response at every level, no matter how big it gets, because that could be a little bit confusing, a little bit cumbersome. It could be an amendment or an addendum to your crisis communication plan, but the core plan should be the communications efforts of your agency.
We're going to go on to Matthew's question. Kellee, if you don't mind, I'd like to make one comment before you answer, because I think I have a good answer for Matthew. Can you share your experience on how to make a communication plan prep a positive experience in an organization and something that stays alive? In my experience, it is that thing that nobody really wants to do. And once someone finally volunteers, it stays something nobody really wants to look at. Matthew, the act of putting together a plan in and of itself is enormously valuable. Even if you never go back and look at it, and I'm not saying that one should do that, but even if you never go back and look at it, the act of writing it down on paper, of thinking through every little step, that means you've thought through your channels, you've thought through who your audiences are going to be, you've made new partnerships so you can reach those people. It compels you to do the prep work that you need. And if you're the one who wrote the plan, you may not have any need to go back to it because you already know what the answers are because you figured them out ahead of time. But if you're not the person who wrote the plan and somebody new is coming in, they very definitely should read the plan because they won't have those answers. Okay, Kellee.
Well, okay, to piggyback on Jonathan's answer, the reason the plan should be developed and the reason the plan should be updated on a regular basis is because the process of doing so, like Jonathan said, is hugely beneficial. Putting you in contact with those partners, keeping you abreast of the latest messaging and the latest points of contact. So it's the process in and of itself that's just as beneficial as having the plan. But again, for someone who isn't part of the process, depending on how you organize it and depending on how you make that plan accessible, ideally someone who is acting as SURG staff or who is supporting your response could just grab that plan, flip to the page they need and see, hey, there's the media contacts that I need to reach out to, or there's the messaging section. This is the messages on, you know, how to prevent the spread of flu, or here's the messages on Tamiflu, and this is what we want to get out. So they should be able, however accessible you make that plan, they should be able to just grab it, flip to the page they need, and use it.
Okay, we're going to go on to a question from Hog Dav. Thanks for an excellent presentation. Do you have any specific examples of issues that have arisen due to being insensitive to local concerns and expertise? The old pro from Dover syndrome.
The pro what? I missed that.
The pro from Dover syndrome. I don't actually know the reference. I apologize, but
I don't know the reference either. But from being insensitive to cultural needs, yes, we've had that happen a few times, which is why, and not specifically CDC, but we've come across several responses of not understanding what the community needs were. So, for example, when we had several staff deploying to Africa to deploy for response to Ebola, the Ebola outbreak between 2014 and 2016, there was a misunderstanding about the importance of funeral rituals. They're very, very hands-on. They're very personalized. And unfortunately, Ebola is extremely contagious even after someone has passed away. So they were also a key in the Ebola outbreak spreading because of the nature of the funeral practices. So us not understanding that and just communicating that people needed to stop touching, that people just needed to follow these specific health practices and just do what they needed to do wasn't helpful. We really needed to understand the culture. We really needed to understand the history. It's thousands of years of, well, maybe hundreds, but hundreds of years of ritual and respect for the loss of a loved one that we are coming in and saying, no, do this instead. And that's not something that typically is well received. You lose a lot of credibility. So that is one of the reasons, not the only, but one of the reasons why our community engagement chapter was crafted. And it's something that now we consider in all of our messaging and consider in our planning, making sure that our partnerships that we'll be able to reach out, because another part of how we responded to that wasn't just changing our messaging and changing our activities, but also working with local tribal chiefs, medicine men, and local ministers to have them explain the importance of the messaging, because we didn't have the credibility in the community that they did.
Okay, Kellee, the next question, this may well be our last question because we're running short on time. And if we don't get to someone's question, please do send the question to epic@cdc.gov. That's EPIC@cdc.gov, and we will try to follow up. So, this question is from Frank Cantoni. What do you do to validate and maintain your plan? Do you conduct exercises specifically for the plan? Do you use after action reports from various incidents to update the plan? Both? Other?
Both. So when we are fortunate in that we have the ability to run a couple of exercises a year. We also are unfortunate in that we are seemingly always activated. So we're always sort of doing after action reports. We're always sort of observing what's going wrong and what could be done better. So if you are activated, definitely take notes, go back to your plan, revisit it, and fix what's wrong. If you aren't activated very often, find time to practice, find time to exercise. It's helpful to do it if it's just your organization. If it's just your organization, great. If you're able to do it with some of your partners, if you're able to plan an exercise with some of your partners in your community, at the county level, at the city level, whatever you can do, even better. So you can see how those partnerships will suss out and how you guys will coordinate messages and make sure that you guys are saying the same thing, or that, you know, whoever's taking point on the right messaging. So both. It's also revisiting it as needed. So if you know that a key point of contact has retired or a key point of contact has left, going ahead and making that change. Or if you know that a key bit of science has changed. So we're learning a lot about different diseases right now. We're learning a lot about different outbreaks. If you know a key bit of information is different and the recommendations have changed, go ahead and change that in your plan if you have something specific to that.
Kellee, we have time for one last question. And I'm selecting this one from Ligia Duarte Botello, because it's very relevant to a lot of work that you have done. As an outsider, for example, humanitarian fighting aid in a foreign country, what are some strategies that may be helpful in gaining the trust of locals? How can that be addressed in a short amount of time given an emergency?
It's really, really helpful to work with already established groups. So both of my trips to Africa during Ebola, for example, we ingrained ourselves with the Red Cross that was already established there, with nonprofit staff that already had a presence on the ground outside of the emergency. It was staff that community members already trusted, people who already spoke the language, or people who already had connections with local community members. It's making those connections to increase your credibility. Then it's explaining why you're there to help, what your purpose is, and then it's listening. Huge part of what you're doing there is to listen to what people need, not to tell them what you think they need. So those three things were really key in the success of my communications efforts in vastly different cultures, and huge hindrances when not done appropriately.
Thank you so much, everyone, for a wonderful Q&A session. We'll go ahead and wrap up the webinar right now. Thank you again for everyone joining us today. And if you do have additional questions or questions that we weren't able to get to, you may email them to epic@cdc.gov. As a reminder, today's presentation has been recorded and you can earn continuing education for your participation. Please follow the instructions found on emergency.cdc.gov/epic. The course access code is EPIC1219 with all letters capitalized. Thank you again, everyone.